Okay, a viewer just asked me, do I think it's a good idea to go for whole body MRI screening? And I would tell you no, it sounds stupid to me. Okay? Patients love this idea of screening. Oh, I'm going to find an early cancer and they're going to save me and everything's going to be great. And what I would say is remember the theme song. I made a recent video about the theme songs for different medical subspecialties. The theme song for radiology is Hotel California. You could never leave. What that means is once you've been scanned, it's very common. Let's say you get a CAT scan, a body CAT scan, body CT we call it, chest, abdomen, and pelvis. They're very commonly going to find a little micronodule in your lungs. They're going to find an atypical kidney cyst, maybe an atypical liver cyst, maybe a sclerotic bone lesion, a little nodule on the adrenals, a cyst in the head of the pancreas, IPMN. Okay, they're going to find a whole bunch of nonsense things. They almost always do. That's why there's a joke in medicine. What's the definition of a healthy person? Somebody who hasn't had a body CT yet. Okay, and I know what you're thinking. Well, I'm talking about body CT. This is about a whole body MRI. MRI is a little different than CT. Yeah, that's true. But you're still going to have the same problems. And like I said, I made a video about calcium CT, cardiac scanning, and I think it's stupid. And the reason is, if you've eaten the Western diet, a SAD diet, standard American diet, you know you got atherosclerosis. You don't need to check for it. You need to fix it. Okay, and how do you fix it? Low fat, low sodium, low protein, vegan diet. That's the best you could do. So why not just start doing that? Why not focus on what cures you, what helps you, which means optimizing your diet, your health, your sleep, and all that stuff. What good is the screening imaging going to do? There's a lot of diseases for which conventional medicine has no significant treatment. Let's say you got a real bad cancer, okay? They might not be able to do anything except just give you chemo, make you sick, okay? Or do a big surgery and make you miserable. Okay, now don't get me wrong. Sometimes what they do can really help, but all I'm telling you, I've been a doctor over 30 years. I've been in radiology many, many years. Gosh, I don't know, getting close to 30 there. And I can tell you, most of these screening studies, I think people would be better off without them. There's a lot of experts, for example, on mammography recommend it shouldn't be done unless the patient has a clinical finding, especially if they're less than 50 years of age. And so there's no reason for me to think whole body MRI is going to be any different. And I'll explain a few things too. I made a previous video about different types of cancers. And this came out of George Kreil over at the Cleveland Clinic, and also Gilbert Wells, who's written a book on screening called Overdiagnose. And you can basically think of cancer as three categories. Imagine you're a farmer that owns this giant farm, 100 square miles, and in the center is a fenced-in enclosure. And in this fenced-in enclosure, you got three types of animals. You got turtles, rabbits, and vultures. Now, a vulture is a very fast-growing cancer. If the vulture gets out, it flies over the fence so fast, you can never diagnose it. Patient's dead. This is the kind of thing they'll make a movie about it. It's rare. All right, but the point I'm saying is you'll miss a vulture. Even if you try to screen, it'll occur between screening intervals and kill the patient before you can ever see it. Okay, then the next one is the rabbit. And a rabbit is what everybody thinks cancer is. It digs underneath the little enclosure and makes a run for the fence, and you got to make a heroic leap and try to stop the rabbit, stop the cancer. And some cancers are like that, and there are some cancers that can do well with treatment, with surgery or radiation, or chemotherapy. But I can tell you, most cancers are turtles, and the turtle, you'd be better off if you didn't know about it, because if you got a turtle-type breast cancer or prostate cancer, the treatment is going to cause real side effects, but you're going to die of something else anyway, so you don't even want to know. And there's a lot of cancers which they really don't have a good treatment for, but they'll usually say, in a sense, it's as if the patient's dead already. We might as well try this chemo. But that chemo is probably not going to help in that context, but it's going to have a lot of side effects. So it's kind of stupid. So what good does it do to diagnose a cancer they can't treat anyways? It doesn't really help you. And I can tell you, the more you know about these things, you would never want them. I got tons of experience. I would never, ever go for one of these screening studies. Never, ever. The smart move is, look, I got tons of knowledge about all this stuff. What I do is I want to minimize my risk as much as possible, because it all comes down to pretest probability. If you eat low fat, low sodium, vegan, get your exercise, get your sleep, and all that stuff, your risk of having anything significant that the medical system could treat is next to nothing. It's so small, it's infinitesimal. So why go for these scans where they're going to find all kinds of irrelevant BS, incidentalomas, and you're going to get trapped in the follow-ups? You might be given the first screening CT, whole body MRI for free, but then guess what? You got to come for the follow-up, and you might have to pay for that in part out of pocket. It could lead to many thousands of dollars of bills. You could be trapped in follow-up for 5 years or more. You could end up going for an unnecessary biopsy, have a side effect of that. I remember there was some article in one of the radiology journals. Some guy was like the chief of radiology at some hospital, and he went for lung cancer screening, and they found a nodule, and they reckoned him for biopsy. And then they had a sedation for him, and they put a Foley catheter, and when they did the biopsy, they caused a pneumothorax. His lung collapsed. Then they had to put a chest tube in, which was super painful. I think he had some side effect from the sedation. He had to have a Foley catheter up his Johnson. And he said and then the biopsy came back normal, just some benign thing. And he remembered, he wrote an article saying, what did I get myself into? I got a chest tube in that's very painful. I have a benign biopsy. I collapsed my lung. I got a Foley catheter up my Johnson, increased risk of urinary tract infection. A big bill for a lot of money. Stupid. Okay, so what I'm trying to tell you is don't be too glamorized by the medical profession. It's there, it can help in certain situations. It's great for acute disease. It's great for end-of-life, end-stage disease. Put a patient on dialysis, do a kidney transplant. That's all great. It's great in the emergency room. It can fix a lot of things. But most of these routine chronic things, if you're smart, what you do is you try to minimize your risk. So here's an example of a whole body MRI. And what I'm saying is they could easily find some little nodule in the lung. You're stuck going for follow-ups for that. There's a lot of things that are kind of confusing at first in the liver, and then you got to get follow-ups for that. Tons and tons of patients. I don't know the exact percentage, but in my experience, it's probably at least 70% of patients have kidney cysts. It might be more than that. And they often, are equivocal on if it's significant or not, and they just keep getting all these ultrasound follow-ups, sometimes CAT scan follow-ups or MRI follow-ups of renal masses. You find weird things in the bones that most of the time they're normal, but you don't know that at first, so you get follow-ups, nodules in the adrenal. So what I'm saying is, why get stuck with all that BS? Just do the things that make you healthy. You don't cure anything by taking a picture. You cure stuff by improving blood flow to it. And how do you do that? Low-fat, low-sodium vegan diet. Let's see, what else? The other thing about MRI is everybody else says it's safe, it's safe, it's safe. And maybe it is, but I wonder a little bit about it. Typical magnet's about 1.5 Tesla. Even 3 Teslas becoming pretty common these days. 1 Tesla is like about 20,000 times the Earth's magnetic field. Okay, so you're putting this giant magnet 20,000 times the Earth's magnetic field. It's moving the protons around all over your body, and then you're hitting it very frequently with all these 90-degree perpendicular gradient fields, and you're knocking these protons out of their normal alignment position, and then you're measuring their rate of recovery. And you do that, let's say, for half an hour, for an hour in a row. That can't be good for you. Now, don't get me wrong. I have not seen, major obvious complications from it. I have not, and I've seen many, many thousands of these. So a major obvious complication is super rare. But, I'm interested in like optimal cognitive function. Why would I take a chance of that? I wouldn't take a chance of it. We don't know for sure, okay? Nobody really closely checks cognitive function to see how optimal it is. Other weird things can happen. If you got a tattoo, you can get a burn in your tattoo. By the way, I think tattoos are stupid. Maybe if you're with some group doing some special thing, life at risk, as a mark of solidarity, you all get a tattoo. But most tattoos just look stupid, low class, tacky. You shouldn't be doing that. So if you're a young person thinking of getting a tattoo, my advice is don't do it, okay? They joke, they call it a tramp stamp. It looks stupid. It can heat up and cause skin burns. If you got metal in your clothing, that can cause skin burns. There's certain things that are contraindicated. Most of the time a pacemaker. There's some special pacemakers that can undergo an MRI. Cochlear implants, most of the time, are contraindications. If you got metal near your eye, your brain, your spine, etc., those are typically contraindications. The contrast material usually is thought to be safe, but potentially you can have side effects. Rarely. It's really rare to have an allergy to it. I would worry, though, people who need chronic follow-ups for some, getting followed up for some, let's say, tumor, internal auditory canal, schwannoma, acoustic neuroma, that they keep on getting these follow-ups every year or two. That can be many follow-ups, and then you'll start sometimes seeing some of that MRI gadolinium contrast accumulate in the brain. So the bottom line is, if you have a real serious problem it might benefit you to get an MRI to evaluate it. But to go randomly looking for a problem, you're most likely going to find a bunch of incidentalomas. Don't get me wrong, I'm sure you'll see a journal article or hear a story about somebody who was saved. They found something early and they saved it. But nobody tells you about all the numerous, many thousands, tens of thousands, hundreds of thousands of patients that have all these BS incidentalomas that go for follow-up for years. I see these things every day, multiple times every day. Me personally, I would never go for one of these screening imaging studies. I do the smart thing. I lower my risk, lower my pretest probability, and avoid all this stuff.